Health Today, the TV magazine dedicated to your good health. Brought to you by the Press of Atlantic City and NBC TV 40. With hosts Bill Elliott and Robin Stoloff. With reports from Margie Barham. And features on state-of-the-art technology, plus wellness tips to keep you healthy. This is Health Today, and here is your host, Robin Stoloff.
Welcome to another edition of Health Today from Shore Memorial Hospital. As parents, we make sure our children have regular medical exams, checking height, weight, and eyesight. But what about cholesterol? In this week's special report, we'll find out if cholesterol testing is necessary for children. And in our wellness segment, we'll have a ball with physical therapy. But first, preterm labor, toxemia, and other problems in pregnancy cause many an anxious moment for expectant parents. The fact is, pregnancy complications are common, but so are good outcomes. When we come back, I'll talk with obstetrician Dr. Korzeniowski, and we'll learn more about the treatment of pregnancy complications. But first, welcome back to Health Today from Shore Memorial Hospital. Nothing could be more exciting than having a healthy baby. Unfortunately, there are many problems in pregnancy, but the good news is there are ways to treat many of these problems. And joining us now is gynecologist Dr. Korzeniowski. Thank you so much for joining us.
Thank you, Robin.
Before we begin, give us a little bit about your background.
Sure. Originally, I'm from Wildwood Crest, and I went to medical school at UCLA in California. And after that, I did my training in obstetrics and gynecology at the University of Pennsylvania. And
you came back.
And excited to do so.
That's great. All right. There are many complications of pregnancy, as we know. But as we said, there are many ways to treat them. Now, the first one would be the most major is miscarriage. Tell us, what is a miscarriage?
Well, a miscarriage is the loss of the pregnancy, generally considered in the first trimester or first 13 weeks of pregnancy. And miscarriages are very, very common. Many people don't realize that up to 20% of all pregnancies are miscarriages.
That is true, and in fact I actually had a miscarriage not very long ago myself, and I know it can be something that's traumatic for many women, but I was very surprised to know once I started telling people that either they had one or their sister or their mother, and it is much more common than women would believe. Now, what causes a miscarriage?
Well, by and large, the majority of miscarriages are caused by a genetic or chromosomal problem that the parents had nothing to do with. So more than half are nature or God's way, and it's not a normal pregnancy. There are some other hormonal causes that are less common, and some patients with medical problems like diabetes or thyroid problems have an increased risk for miscarriage as well.
The first thing a woman might think of, and I know I did, was, what did I do wrong? And it's really important for women to know that most of the time it's nothing that they did. Is that right? Absolutely.
The parents, the woman and her partner are not to blame for a miscarriage, except in rare cases. It's nothing that the woman did or could have done to prevent it. Generally, it's just a very unfortunate complication that the woman really had no blame, or her partner.
And sometimes it's just nature's way.
Right.
And you have to accept that.
Absolutely.
What are some of the common myths that do not cause a miscarriage?
Well, some people have heard in the past that exercise, strenuous activity, sexual activity could cause a miscarriage, and they're all false. Miscarriages are caused by the things we talked about, and generally not anything the woman did or didn't do.
But it's also important to realize that you do play an active role in your health and the health of your baby. There are some steps and some tips for women even before they get pregnant that can help them with having a healthy baby.
Right, absolutely. Probably the most important thing a woman can do is take a multivitamin on a daily basis that has folic acid in it. And it's important to take that before she gets pregnant for a good 2 to 3 months, because that folic acid can prevent a birth defect called spina bifida. So taking vitamins on a daily basis is very important, not only if you're planning a pregnancy, but some pregnancies are surprises, and therefore being on a vitamin a day is a very good idea.
So if you're sexually active and in childbearing age, be on a vitamin with folic acid in it every day. That's important. And also not smoking, taking care of yourself, that goes without saying.
Yes, absolutely.
Yeah, of course, with everything. Almost every show we do, not smoking and not drinking too much alcohol plays a big factor in preventing whatever problem it is. Now, if a woman has a miscarriage, what are the chances that she'll have another one?
Well, recurrent miscarriage, defined as 2 or more, is very uncommon. Happens in only about 1 or 2% of women who have a miscarriage. So if a woman has a miscarriage, the chances are very, very small that she'll have another.
Is there anything you have to do differently when trying to have another baby?
If you've had a miscarriage, not necessarily, just the things you've mentioned, taking the vitamin every day, taking care of yourself, not smoking, limiting alcohol intake, and generally exercising and being healthy are really the things you need to do.
What role does advanced age in a woman play? A lot of women are having babies now over the age of 35. What role does that have in miscarriage?
Well, as a woman gets older, there are higher risks of having a baby with a chromosome problem, and that can lead to increased miscarriages. So there's nothing that a woman who's older can change or do about it, but the older a woman gets, she has a slightly increased risk of miscarriage the older she does get.
All right, many doctors are now telling their patients that it is safer for a woman to try to have their children maybe before 40 at least, or around 35.
Right, because the older you get, the complications do increase, not only miscarriage, but things we're going to talk about like high blood pressure or toxemia.
Sure. Now, you mentioned toxemia. Let's get into that a bit. What is that?
Toxemia is a complication usually in the last month or 2 of pregnancy where a woman's blood pressure rises and she has other complications like protein in her urine and swelling.
Do we know what causes it?
We don't know what causes toxemia. There's something about the way the placenta sets in the uterus, but the research really hasn't proven what the cause is.
Can it be treated?
Toxemia cannot be treated as far as cured. The only cure for toxemia is delivery of the mother.
And if the mother is not really, the baby's not full term, what can be done?
Right, that becomes a dangerous situation because you're balancing the health of the mother versus the health of a preterm baby. There are some medicines that can be given to a mother that would help a preterm baby survive and be able to breathe easier if it must be delivered early. There are some medicines that can be given if a baby is very preterm to control the mother's blood pressure and allow her to stay pregnant a little bit longer. But if a woman reaches full term between 3 to 4 weeks of her due date and she has toxemia, the treatment really is delivery.
And seizures are a big problem with toxemia.
Right, the main risk of toxemia is seizures or something called eclampsia, and that is very dangerous. Eclampsia and toxemia are responsible for about 25% of the maternal deaths in the United States.
That's interesting. Now, there were studies done to see if toxemia could be prevented, is that correct?
Right. There was some very interesting research 5 or 10 years ago suggesting that taking calcium supplements or aspirin on a daily basis could prevent toxemia, and unfortunately it didn't work out, and at this point there's nothing known that can prevent it, but we do know how to treat it.
Okay, well that's good news. Another complication of pregnancy is preterm labor. What is that?
Preterm labor is when a woman is more than about a month before her due date and she has contractions or labor pains and her cervix starts to open up or dilate.
And this is very common?
Also very common. Between 10 and 20% of pregnancies will be complicated by preterm labor.
What causes preterm labor?
By and large, again, it's another mystery. For most patients, we don't know why they have preterm labor. For other patients, there are known risk factors like twins or triplets, infections, things like that. But generally, for the uncomplicated single baby, we just don't know why it occurs.
Can preterm labor be prevented or treated in any way?
Well, it can't be prevented, but we do have treatments that can help stop contractions. There are medicines that can be given intravenously and by mouth that for many patients will stop preterm labor. And again, there's a medicine we can give to the mother that if the baby has to be born, the baby will have a better chance of being able to breathe and surviving.
That's a big problem with preterm babies, isn't it? That their lungs are just not developed.
Absolutely. The lungs are really the key problem with preterm babies and survival and complications. Preterm babies do have other problems with their brains and the kidneys and the heart, but the key for survival for most preterm babies is, are their lungs ready to breathe in the outside world?
Okay, great. So it's good to know that we can do some things about preterm labor and hopefully with miscarriages, mothers taking care of themselves and hopefully have some healthy babies, and also with toxemia there are treatments for that. So
Absolutely.
It's good to know they're the 3 main complications of pregnancy.
Yes, they are extremely common, but by and large we do have treatments to help most patients with these complications. And for patients that do have a miscarriage, again, it's important for them not to blame themselves and to take care of themselves and know that the chances are very high that next time things are going to be just fine.
That's great news. Thank you so much for joining us.
Sure, thank you.
Korzeniowski. And coming up more minutes with obstetrician Dr. Philip Korzeniowski about some of the warning signs and symptoms of these complications of pregnancy, the first being miscarriage.
Sure. The warning signs of miscarriage generally include bleeding and cramps, but bleeding is probably the main warning sign. So if a patient has any bleeding in early pregnancy or cramps, pain, could be one side or the other, she really needs to call her doctor.
But sometimes, as with modern technology, as was with my case, you find it out when you go to get an ultrasound, and they just found that the baby's heart had stopped beating. And sometimes that's better for a woman because you don't have to go through the trauma of all that bleeding and cramping, and many times it's treated with DNC or...
Yes, some patients do find out at an early ultrasound. As you mentioned, with modern technology, we can see a little embryo with a heartbeat as early as 5 or 6 weeks. So we're ordering ultrasounds earlier, and unfortunately it's not always good news because, you know, obviously the pregnancy did not thrive, but some patients do not get an early ultrasound and then they do have bleeding or cramps that they should call their doctor.
Well, it's important to stick with getting in to seeing your doctor regular visits, especially when you're pregnant. And what about preterm labor? What are some of the warning signs?
Warning signs of preterm labor generally include cramping or contractions. Now, some patients, especially if it's their first baby, they're not sure what they're feeling. So some patients have described it as the baby's balling up or a tightening, and they didn't realize it's really labor pains. So if a patient is pregnant and she's having cramps that feel menstrual-like, or the baby's balling up, or tightening, any kind of a persistent abdominal pain, that's one clear warning sign, as can be bleeding or leakage of fluid or vaginal discharge, and a fever. Any of those things, she really should call her doctor.
Don't take a chance. I mean, it could be something else, but if you have any kind of pain when you're pregnant, don't take a chance.
Right, it's always safer to call and get checked out.
Sure, and then hopefully they say it's really nothing. Right. And then what about toxemia, some warning signs?
Toxemia has many warning signs. The one that patients usually notice is swelling. Now, not all patients that have swelling in pregnancy have toxemia. As long as their blood pressure is normal and they don't have protein in their urine, the swelling can just be an annoyance, not a severe problem. So swelling of the legs or sometimes the hands or the face is one important warning sign. There are other ones like severe headaches, blurry vision, or pain in the upper right side where the liver is. Those are some more serious signs of severe toxemia. Okay. So if you're in the last stage of your pregnancy and you're having horrible headaches or swelling, blurry vision, pain in your upper abdomen, you need to call your doctor right away.
Okay, that's very important. Also, something we really didn't touch on much is diabetes during pregnancy.
Right, diabetes is fairly common. There are patients that have diabetes before they're pregnant, and then there are other ones where we diagnose it in pregnancy. All women are generally tested at about 7 months for something called gestational diabetes with a type of blood test after they drink a sugar water solution.
I did it.
And if that's abnormal, then there's a more complicated 3-hour test that diagnoses gestational diabetes. And if a woman has that, generally she can control her blood sugar with a special diet and exercise. For women that can't control their blood sugar with those measures, there are medical treatments, which usually has been insulin, but recently there has been some oral medications that have been tested in pregnancy and deemed safe for diabetes in pregnancy.
So great news, really
Absolutely.
Great news. Medical science is advancing and helping women, but also we do have to help ourselves and take care of ourselves, make sure we get our folic acid, don't smoke, don't drink to excess, and make sure we eat healthy. And that's the best way. A healthier mom means a healthier baby.
Absolutely.
And I have to say, Dr. Korzeniowski delivered my baby, so my son, who's now almost 2 years old. So everything worked out great there, and did a wonderful job.
Thank you.
And thank you so much for joining us and sharing this important information.
Thank you very much, Robin. Glad to be here.
Okay, great. And copies of this and other Health Today shows are available at your local library. If you have questions or suggestions for future shows, we'd love to hear from you. Just call the Community Relations Office at Shore Memorial Hospital. Remember, when you're surfing the net, visit the Shore Memorial website for a complete guide to hospital services and physicians. From the entire Shore Memorial Health Today staff, thanks for joining us. I'm Robin Stoloff, wishing you good health today.